Hello, my name is Brooke Dobo. I'm a pelvic health physiotherapist and founder of Embody Pelvic Health. I work here at Vera Wellness, situated in the Samford Valley in southeast Queensland, and it gives me great pleasure to offer up today some nice tangible strategies that may help you if you have been suffering with pelvic pain. Firstly, I will go over some strategies for calming the nervous system, which is a really important factor if you've been experiencing pelvic pain, particularly if it's been chronic or persistent. Secondly, I will go over some bladder and bowel optimization strategies, which are again crucial to your pelvic health and often will play into a pelvic pain journey. And lastly, I will go over some tangible strategies for connecting, perhaps reconnecting to your pelvis, which is crucial for healing pelvic pain. Let's get started. Let's start with perhaps the most important aspect, which is addressing the state of your nervous system. When you have been in pain for a long time, so long-standing or persistent pain, it's not uncommon for our nervous systems to be predominantly in a survival state. That is our sympathetic nervous system state. We need this part of our nervous system for survival. However, when we are stuck in survival mode, it can have detrimental and significant impacts on our pain, particularly in pelvic pain. Physiologically, so at a cellular level, pain receptors, when you're in the survival state, actually become more receptive, so more responsive to any particular triggers or threats. So what that means is if you have any amount of pain, whether it's perhaps like an inflammatory process, discomfort with period pain or menstrual bleeds, those pain signals will be amplified if you're in that survival mode. So what I'm going to run through now is one really helpful strategy for helping to calm your nervous system down. This is a really helpful exercise. It's not easy and it takes practice, but when you master it, can become so helpful when you're feeling in a heightened state, when you're feeling like you're in that survival mode. I have seen countless people be able to bring their pain levels down simply with this exercise. You may have tried this before, and everyone teaches it differently. It's diaphragmatic breathing. Another bonus of this exercise is that it helps to release tension in our bellies and in our pelvic floor. You can be in any position to practice this exercise, but if you can, try and find a nice, comfortable position, and I'll run you through this now. What I invite you to do is take one hand to your chest and the other hand right down low on your lower belly. The first thing that can be nice to do is just take a deep breath and notice where in your body is that movement occurring with your breath at this time. Is it up in your chest? Is it down in your belly? If it is up in your chest, you may be in that survival mode. Now, this may not be a bad thing. Perhaps you are busy right now and you're in go, go, go mode. And what this means is we need these accessory muscles to breathe faster and heavier. However, when we are at a time when we are, or should be, calm and rested, this is when our sympathetic nervous system needs to dial down. And this is a hack to our nervous system to dial that down and turn on, conversely, the rest and digest, or the parasympathetic. Now, when we are in a rest and digest state of nervous system, we really shouldn't be using these accessory muscles up here to be breathing. We should be able to breathe with our diaphragm, as this is the way we're meant to breathe when we're in a rested state, which means breathing into the belly. Slowly give it a go as I keep talking. one little trick is if you ever get an opportunity to watch a baby or a toddler sleeping, you will see that they breathe into their belly. They use their diaphragm. And that's the way we are meant to breathe when we're rested, like I mentioned. However, this is often lost when we are so busy. Then we cue pain, and what happens here? We're getting locked up, disconnected from this part of our body. So the aim of this exercise is to start tuning into this part of our body, releasing any tension that might be held, and start using that diaphragm to breathe into this space. Now, it's really important that we don't push or force anything. It's merely just a letting go, almost like an expansion of this part of our body. As you're going, keep the breath really slow and deep. Let's try a few rounds of breath together. So breathing into the belly. And then on the exhale, just think about softening everything. Everything is staying soft and supported by the chair or the couch or the floor, wherever you are. And again, breathing into the belly. It's almost like you're blowing up a balloon in your lower belly. And you can think about blowing up a balloon into your pelvic bowl, that expansion. And then a softening on the exhale. Let's do one more. Deep inhale, blowing up that balloon. And then a softening on the exhale. So like I said, this is not easy. It takes practice. But you can use this if you are either feeling a bit overwhelmed and stressed, and or if you feel some pelvic pain ramping up. Like I said, it addresses two things, and that is your nervous system, so calming things down, dialing those pain signals down, and it is possible with the breath to do that. You can get control with practice. And then it also has that added benefit of helping to release any held tension that might be around here. It's also really good for your digestion. If you have any bloating or gastrointestinal issues, this again is a hack to that, because you're getting into that rest and digest state of your nervous system, which gets more energy to this part of your body. Give it a go. Practice it every day. As soon as you wake up is a really good time to practice, when you're in a calm and rested state, and you'll find that it will get easier. And I hope that this tip helps. Another really important strategy for when you have been experiencing pelvic pain or endometriosis associated pain is addressing and optimizing your bladder and your bowel. Within the pelvis, everything is down there together. Your bladder at the front, your bowel at the back, if you have a uterus sitting on top of that as well. And so all of the nerves that innervate these organs, plus your pelvic floor muscles that hold everything underneath that, they're innervated by the same nerves, which means if you have an unhappy bladder, chances are you might also have an unhappy pelvic floor or bowel or uterus, and vice versa. We call that crosstalk, and it's really common sensitization process that can happen. Not to mention, if you're constipated, for example, that bowel could be potentially putting pressure on your pelvic floor and your bladder in the front. So that's why it's really important to address these. Now, it's really important to note that this information that I'm giving you is very generalized, and before you start to trial implementing any of these strategies, it's really important to seek individualized advice from your medical practitioner. But I'm just going to run through some really basic healthy bladder and bowel habits. If we start with the bladder, first of all, water, plenty of water. Again, very generalized, but we would be aiming for roughly 1.5 to 2 liters of fluid, mostly water, in the day. That is so that your system is adequately hydrated. In terms of how often you should be voiding your bladder, normally we would say anywhere between 4 and 6 times is a good aim and a good indication that your bladder is functioning to an appropriate amount. If it's less than this, or if it's more, which is more common, frequency, it's a really good idea to consider your bladder habits and what's going on. What's really important is that, again, you seek medical advice, and particularly from a pelvic health physio, can really hone in on your bladder habits and give you advice around that. The next thing is your bowel, and addressing if you have constipation or IBS symptoms, or maybe you have really loose bowels as well. This is, you probably may or may not have seen this before. If you see a pelvic health physiotherapist, we will likely bring it up because it's so important. Your poos are one of the report cards of your health. Where we want to be aiming for in terms of our stool consistency, most of all. I mean, we're not going to have this perfect poo every day because we do different things and we eat different things, but generally we're aiming for around this area here. So a nice soft formed sausage that's easy to pass. Again, if we're looking at normative values, as people often ask me, normal in terms of how often you open your bowels is anywhere from 3 times a day to every 3 days. As long as there is that regularity, you're not feeling bloated or blocked up, and you're going regularly. I'll now give you a little tip lastly on this area, on the best position to open your bowels. This is a topic of conversation you don't often have over the dinner table with your friends, but it's a really important one, and that is to be aiming to have really good, healthy bowel motions. There are a few tips on my list to get that perfect poo where we're not pushing or straining, potentially causing damage to our pelvic floor. The first thing is what we just spoke about on the chart, aiming for that really good stool type, that nice soft sausage. The second thing is the timing. As best you can, getting to the toilet when you feel a good urge to go, when you really need to open your bowels, because that's when it's there and it's ready to come out. The third thing is getting yourself one of these puppies, and if you don't already have a poop stool or something like this, the squatty potty, please consider it. It's a game changer. The third thing is getting in the correct position, which is, research informs us, a squat position. Why this is most important, and the best position, the way that the human body is designed to defecate in, is because it aligns our bowel nice and straight to enable a stool to fall out easily. It also is the best position to help our pelvic floor muscles relax, because that's the last state. If those 3 things are in alignment, good stool type, soft sausage, good timing, you're ready to go, good positioning in this nice, relax, you need to be comfortable, relax, forward lean squat position. If those 3 things are aligned, then all you need to become confident in is how to relax your pelvic floor. And this is where our first tip comes in. Again, beautiful, deep, relaxed, diaphragmatic belly breaths to help relax the pelvic floor. And if all of that works, happy days, gravity takes over and you give yourself a high five. Now, it's not always that simple. And like I said, seek help from a medical professional, particularly a pelvic floor physio on this topic, because this is our bread and butter, if these tips are not working for you. My third and final strategy for today is offering some advice and education on how you may connect to your pelvis. When you have been experiencing long-standing pelvic pain, it's not uncommon for the brain to disconnect from this part of our body. And that is to be able to continue to function and do all the things you need to do. But this becomes really hard to heal this part of your body when there's disconnect, when we're not connected to it. So one usually crucial piece of the puzzle to your recovery and healing pelvic pain is to reconnect. Now, we need to be creative in how we connect to our pelvic floor. It's not like a bicep where we can see the movement on the outside. Pelvic floor muscles are all internal. So it's really difficult for us to even perceive that they're there. We don't know what we don't know, and until someone tells us muscles are there and teaches us how to connect and control those muscles, often we can be in pain and not realize that muscle tension could be contributing to that pain. So one of the cheapest and easiest, well, not necessarily easy, but potentially easy way for connecting to this part of our body is through visual. We've got lots of different biofeedback tools as pelvic health physios, but the first thing you could do is literally just get a mirror. So something like this is one that I have designed. It doesn't have to be like this, but this is a good size. It can just be a long length mirror if you can set yourself up in your bedroom. It can be nice to have something to relax against, but there's no rules about this. You just want to be as comfortable as possible. Now, if staring at your vulva is something that you're not comfortable doing, that's okay. You do not have to be thinking that you have to do this exercise. It's certainly something that a health professional can help you with. But if it's something that you're comfortable with and you've done it before, or you may never have looked at your vulva before but are curious and interested, it's a really great place to start. So setting yourself up, a mirror like this with an angle can be helpful. I've done a lot of research on the perfect mirror, and it's actually quite hard to find one that angles perfectly, so that can be helpful. But have a little play. It might take a few minutes to get set up. Now, the first thing you want to do when you get to this point is to just have a look, be curious, identify your anatomy. On this model, first of all, no two vulvas look the same. They're as unique as faces, but generally you should be able to find most of the anatomy. So you've got outer labia with or without hair, inner labia with clean hands. You might be comfortable to separate the outer labia to be able to visualize some of these anatomical structures. You might find the glands of the clitoris, which is up the top, remembering that the clitoris is not just that little knobbly bit at the top, which we often think about. It extends underneath and has all these amazing magical powers. Then you might be able to see your tiny little urethra where the wee comes out. You've got your vaginal opening here, perineal body here, that's the skin between the vaginal opening and the anus. Now you could just leave it there. Again, this is just a great way to start mapping out this part of your body on your brain, which is likely not that well represented. This is going to be helpful, like I said, in healing this part of your body. The next thing you could do is to attempt a pelvic floor muscle contraction. Now, I could go on a lot about different cues for activating these muscles. And again, if you're not sure, go and seek help, particularly from a pelvic health physio. They can help you with this. But if you have an idea, generally it's like holding on to holding on to wind, squeezing the muscles around this part of your body. You might be able to visualize that in a mirror. Now, this model shows that, if you look nice and closely here, if you go to squeeze your pelvic floor, maybe you might not see anything, and that is okay, but maybe you might see this little movement here. Looking around, mostly around the perineal body, can you see squeeze, release, squeeze, release, one more, squeeze, release. Now, this can be really helpful at starting not only to connect brain to this part of your body, but improving motor control, literally the brain controlling these muscles. Now, this can become very helpful if you can start to identify that, yes, indeed, when I have pain, my muscles are tense, because then you can start to improve being able to consciously release that, which can bring pain down. I hope you have found these strategies helpful for you today. They are by no means near an exhaustive list of things that you can do to help your pelvic pain, but I do hope that you can see, perhaps with the help of your health professional, how they can be helpful to your pelvic pain. Thank you so much for listening.